This is our People podcast, telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
Hello and welcome to our People podcast. My name is Beth Smith and I'm our PR and social media assistant here at the Trust. I'm joined today by Nathan King from our safeguarding team here at STSFT, and today we're going to be speaking all about the White Ribbon and why it's so important. If you'd like to introduce yourself a little.
Hello, my name's Nathan and I'm one of the domestic abuse health advocates as part of the safeguarding team here at the Trust.
Amazing. How are you today? All fine?
All good, yeah.
Good. To get to know you a little bit better, we'll start with some quick fire questions. Nothing stressful, just to warm us up a little bit.
Okay.
So, early bird or night owl?
Night owl.
Tea or coffee?
Coffee, definitely.
Who or what inspires you?
Ooh, good question. Probably my parents.
What a lovely answer. And what is your favourite thing about the North East?
Definitely the people, because I'm not from the North East originally. But yeah, definitely the people.
Where are you from?
Carlisle.
That wasn't part of the quick question, but yeah, I'm just...
Yeah, that's it, yeah. Originally from Carlisle.
So what was your favourite subject in school?
Probably psychology at A level.
And finally, can you share one word to describe your job? It's a toughie.
That is a toughie. One word. Unpredictable. I'll go with that one. Unpredictable.
And you'll be happy to hear that as the end of the quick fire questions. So now a bit more about you and your role here at the Trust. So can you describe what you do day to day?
So, like I said, I'm one of the domestic abuse health advocates as part of the domestic abuse health advocate team, and we're within the safeguarding team and safeguarding services at the Trust. So our main role is to give direct support to victims of domestic abuse, and that also includes to staff as well. So we work across the acute hospital sites, seeing victims both in the emergency department and across the ward, and even outpatients as well. Our kind of main role is to listen to victims, provide emotional and practical support. As part of that, we complete risk assessments. So we look at the risks posed to the victim. We ask them about additional needs, so like substance use, alcohol use, mental health, make referrals into them services as well. Look at safety planning, so ensuring that the discharge that can be as safe as possible. Also, we look at, if needed, if they don't feel safe to go back home, getting them to some emergency or temporary accommodation if required. And we just kind of make sure that everything is in place for them when they leave hospital, so including referrals to like community domestic abuse support services as well. Like I said, we also support staff, so we can speak to staff who are victims of domestic abuse or think they might be victims of domestic abuse. We kind of also give advice to staff members who think someone in their team or a colleague might be going through domestic abuse and experiencing domestic abuse. We can speak with staff members, again, do risk assessments, safety planning both at home and at work as well, look at kind of what reasonable adjustments work might need to make for them as well, so ensure that they know that they're supported by the Trust. And again, making sure they've got like community domestic abuse support as well. We also attend MARAC, so multi-agency risk assessment conferences, where we discuss high-risk cases of domestic abuse where we think someone might be significantly harmed. We also get inquiries from other agencies such as the police and housing, and we work kind of in a multi-agency collaboration with other agencies as well. And we also give training and advice and guidance to community staff as well. So quite a wide range of things.
No 2 days are the same, I can imagine.
Definitely not, no.
So how did you get into this role?
So I went to university, and then after I left university I worked in drug and alcohol services. I worked with criminal justice clients, and I had a caseload of clients. Some of them were female clients who were also high-risk domestic abuse victims as well. But I had one male on my caseload, and he made a disclosure of domestic abuse to me. Followed like my organisation at the time's process, including risk assessment and completing a MARAC referral. And I just found the process really interesting. And like I felt really privileged that he'd made a disclosure of domestic abuse to me, and it got me kind of re-interested in domestic abuse. So I'd learnt a bit about it at uni, and then so it kind of got me into it. And then I saw this job, and I knew I didn't have the experience, but I just thought, you know what, I'm just going to go for the interview. It sounds really interesting.
Amazing.
It sounds like a really good job. And quite fortunately, even though I didn't have the experience, I was offered a development post to get the relevant qualifications, and yeah, here we are about 2 years later.
Amazing. And how are you finding it?
Yeah, still really enjoying it. It can be hard some days, but it's worth it in the end when you get to see the difference that you made to people.
I can imagine it's quite... How do you find not taking the work home with you?
Yeah, that's something that you have to work on. It's took me a while to be able to kind of work with that, but we've got a really good team, like the domestic abuse health advocate team, and we've got a really good safeguarding team as well. And we just talk about things, and we all talk to each other before we go home, and we do like supervision, like we talk about cases, and just make sure that no one's ever struggling, and we all share the workload. So yeah, work within a really good team, so that helps.
So in terms of healthcare, what does safeguarding mean, and how does that link with domestic abuse advocacy?
So when we're talking about safeguarding in general, we're talking about protecting people from harm, abuse or neglect, which includes self-neglect as well. And we're quite privileged, like working in healthcare, because we can often spot signs that other professionals might not. That can be like physical injuries, their appearance when they're attending appointments, when they attend A&E, their emotional state, and if they're attending frequently as well. And that, the level that any healthcare worker can spot that is right up there, from consultant level to even, the receptionist on ED when someone just first checks in. And as professionals, obviously, we've got a duty of care to safeguard and raise concerns for the welfare of our patients as well. So when we're kind of talking about domestic abuse advocacy, again, we're quite privileged working in healthcare, because all victims of domestic abuse, whether they will attend for a domestic abuse reason, will access the healthcare system, whether that's attending hospital for ED, for an outpatient appointment, whether they're going to the GP, or whether they're going to a mental health appointment. And therefore, healthcare workers are often the first professionals to have contact with victims, and disclosures are often made at appointments, even when professionals don't ask, sometimes because they're the first person that victim might see. I think as well, particularly around domestic abuse, it's kind of, when thinking about like the effects of domestic abuse, so a lot of victims will use alcohol or substance use as a coping mechanism, and often that can draw people into the healthcare system even more. Mental health can also be really affected by domestic abuse as well. So again, that can cause victims to seek support for their mental health, attend mental health services, engage with a crisis team, etc. And also maternity as well. So what we know about domestic abuse victims when they're pregnant is that domestic abuse seems to get worse during pregnancy. And again, we're quite fortunate. We've got really good maternity services here, both acute and community. And that's another way that victims can just be in the healthcare system, and there's ways that staff can facilitate conversations around domestic abuse and ask the questions. So yeah, we're very fortunate being able to work in healthcare and getting that opportunity for victims to disclose domestic abuse and act on that.
For listeners who may not be familiar with the campaign, what is the White Ribbon campaign, and what does it stand for?
So the White Ribbon campaign is actually a global initiative, and it's looking at ending male violence against women and girls. It encourages men and boys to stand against violence against women and girls, and to speak out about sexism and misogyny, and to take action to make their community safer. So in the UK, White Ribbon UK is the leading charity in ending male violence against women and girls, and they focus on raising awareness and campaigning, and focus on engaging men and boys in the subject. And it's recognised by, I think it's over about 100 organisations, White Ribbon UK, including local authorities, health, and universities, and even football clubs as well. So there's quite a wide range of organisations that are involved in White Ribbon.
Amazing. And why does it focus specifically on men's role in ending the violence?
So that's a really good question. And globally and statistically, it's known that women are more likely to be victims of violence and men are more likely to be perpetrators. And that's something that's recognised very highly in society, even right up to the United Nations. And when we're looking at violence against women and girls, it's not just about domestic abuse, but it's also about sexual violence and harassment as well. We're not saying, and White Ribbon are not saying, that all men are violent, absolutely not. But it just highlights that what it wants to do is highlight that the problem is rooted in male behaviour and societal and social norms. And whilst women are disproportionately the victims, violence also damages families and communities as well, which will also have an impact on men as well. And so by encouraging men to be part of the campaign, it acknowledges that preventing violence isn't just a women's issue and that it is everyone's issue. The campaign does try to look at traditional ideas of masculinity, so being dominant and aggressive and emotionally detached, and how that can contribute to violent behaviour. So having men involved in discussions can help to try and redefine what we know as masculinity into a more healthier and respectful, non-violent way. And also looking at what men can do about speaking up as well. So trying to tackle men being silent when there's sexist jokes or harassment happening, where women are the centre of that joke or the harassment. So it's kind of putting the focus specifically onto men.
It's about being an ally as well as...
Yeah, or White Ribbon refer to them as ambassadors.
So what does it mean for our trust to be White Ribbon-accredited, and what commitments have we made?
So when we signed up to become White Ribbon-accredited, we've had to create a 3-year action plan, which we're currently overseeing. I think we've finished the first year, so we're into the second year of the action plan now. So the main commitment we want was just to have a positive and safe culture at work for both the staff and the patients as well. What we're trying to do as part of the 3-year action plan is to make sure that staff are knowledgeable and skillful in recognising and addressing violence against women and girls, including abusive and sexist behaviour. And by doing that, we can hopefully improve the experience of our patients as well, because staff have that knowledge and skill set and they can act upon any concerns that are raised by any of our patients coming in. With that as well, we also want to try and raise awareness among staff, enabling them to become allies and positive role models, influence wider societal change as well, so getting people to address violence against women and girls outside of work, talking about it at home with their friends, with their families, in the communities, engaging with anything like the local authority or a football club is doing, or school that the children might attend who are addressing White Ribbon. It's just about getting the message out there and getting information spread out.
Brilliant. And how has the White Ribbon shaped our trust's approach to domestic abuse and safeguarding?
Definitely, I think the main thing that we've seen is kind of the higher awareness of domestic abuse. We're seeing more kind of referrals into our team, which we're hoping is because staff are becoming more aware of domestic abuse and spotting it earlier and more, especially in the patient's journey. We've also made changes to policies as well in line with our action plan, which included policies with HR to cover male violence against women and girls, and we also have a new domestic abuse policy so that staff are supported and there's a policy in place, so it's structured support as well. And we've also developed a staff training strategy as well, where male violence against women and girls, including domestic abuse, sexual violence and coercive control, are implemented into the training packages that staff can access and have to do with the mandatory training as well.
Brilliant. So can you share any examples of how different staff has engaged with the campaign, how it's influenced any practice?
So we have as part of to oversee the White Ribbon Action Plan, we have a White Ribbon steering group that includes staff of all levels and from all areas of the trust, encompassing both acute and community staff. So we've got a true representation of all the staff across the trust. This steering group has overseen the development of the action plan and how it's been implemented, and been able to contribute to the changes that were made across the trust. And everybody that is part of that steering group has signed up to be a White Ribbon champion or ambassador. And the steering group also includes male colleagues as well. Kind of like what I said before, we have seen an increase in referrals to our team specifically, which would suggest that domestic abuse is being noticed more by staff and they're taking the appropriate actions. And last year, when we were in the first year of kind of launching the White Ribbon campaign, just after we become accredited, we went around as many departments as we could across the hospitals and the community and tried to get staff to sign the White Ribbon Pledge to show that they would never use or excuse male violence against women and girls.
Amazing. There's so much going on, isn't there?
Yeah. Wait till you hear about this year.
Yeah, you wait. So what kind of, we've probably covered this to be fair, but what kind of training or resources are available?
So staff can become white ribbon champions or ambassadors. So ambassadors are men or people who identify as a man who take on the responsibility to never use or excuse men's violence against women and girls. And when they sign up to become an ambassador, they sign, have a look at a code of conduct and watch some videos. And what their role is to ensure that they take the message into their workplace, into their homes, and their family and friends, and just talk about it. And then for champions, they're women and people who don't identify as being a man, and they promise to promote the white ribbon message, encourage and challenge men to get involved by finding opportunities to inspire and inform them about male violence against women and girls. And the champions also hold us to account as well and make sure that women's voices are kind of at the forefront of the action plan and what White Ribbon stands for.
Brilliant. It's such an important campaign.
It is, yeah.
So what are some common misconceptions about domestic abuse that you encounter?
So there's quite a few. I'll try and be brief. I think the main one, which I think society in general is doing really well to move away from, is kind of saying the question, well, why don't you just leave? And for someone who doesn't know a lot about domestic abuse, I can understand why they might say that. But when you start to understand how complex domestic abuse is, there are so many barriers to ending relationships, whether that because the perpetrator has made very violent and very real threats to harm that person, their children or their loved ones or somebody else, whether the level of control within the relationship is just that much, the victim has no access to finances, there's no way to actually leave that relationship. Unfortunately as well, housing and emergency accommodation and refuge is very, very sparse across the country, so trying to get someone to a safe accommodation can be really difficult as well. So there are a lot of barriers to why people can't end domestic abuse relationships. Another misconception is that police are often the kind of number one agency to kind of deal with domestic abuse. The police approach to domestic abuse is getting a lot better, which is really good to see. But obviously police are there for a criminal aspect, whereas there are so many other agencies that can support all victims of domestic abuse, particularly community domestic abuse services. They can work with the victim as part of a caseload. They'll make sure that there's ongoing risk assessments, complete that safety planning, look at what the barriers to ending the relationship are and helping them overcome them barriers and help them make sure they can leave that relationship as safely as possible. And it might not be immediately, and if they do have to stay in that relationship, or if the victim chooses to stay in that relationship, they're not there to judge, they're there just to support that victim and just make sure they're as safe as possible. Another misconception we often see is that we only kind of see female victims of domestic abuse, which isn't true. Kind of again talking about how lucky we are working in health, we see everybody, absolutely everybody across every community, every gender, every sexuality, every religion, every ethnicity, and we will see any domestic abuse victim regardless of any protected characteristics. We're there to support everybody.
Misconceptions are almost not understanding also, isn't
Yeah.
it? Not fully understanding someone's situation.
Yeah, definitely. It doesn't always come from a bad place.
Yeah.
It can sometimes just be misinformed. And I think at the minute with the internet and everything, it's really easy to get misinformed information as well.
Yeah, misinformed information on the internet is a whole...
Yes.
It's a
Whole other podcast.
It's a whole other podcast. So with this, how do we go about encouraging open conversations about abuse, especially in environments where they might be normalised?
So the main thing I would say is trying to make safe and trusting environments, because often people don't realise what domestic abuse is, what counts as abuse. People might feel ashamed to talk to their colleagues or friends about what abuse is, or if it's a patient, may feel ashamed to speak to a professional about it, or they might just be afraid that no one will believe them as well. So talking about it kind of more openly as abuse and domestic abuse being more of like a well-being issue rather than a private matter, having posters in offices and in departments, showing people that it's not a taboo subject, that you can talk about experiences, you can talk to someone even if it's not in the office or in the emergency department. There might be a phone number on that poster that might just be what that victim needs in that time, and they might not act on it straight away, but they might just think, I might just write that number down and I might contact them in a couple of weeks. And what is important as well is the language that we use as well. So making sure that we don't use any victim blaming language, kind of what I just touched on, so saying, you know, why don't you just leave? Or when we're talking more about maybe sexual violence or harassment, not using language such as, well, what did you do? Or what were you wearing for that to happen? So language is important as well when we're trying to have these open conversations. But just wanting to show that you're there to help, and you can be a trusting person, and asking open questions, you know, even if you're not just, you know, not outright saying, are you being abused at home? It's, you know, is everything okay at home? Is there anything you want to talk to me about? Kind of just some open, generalised questions, and being honest if you've got any worries with someone as well. And that just shows that you care and that you can create that safe and trusting environment for people.
Brilliant. It's so important for everyone to have a sort of awareness about it, even if you're not experiencing or someone you know is experienced, you never do know. Definitely.
And we don't expect all staff to be experts. Absolutely. It's just knowing what to do if something is disclosed to you. Who do you turn to? Who do you go to? What do you say to that person in the first instance? Because you might be the only and first person that person, that colleague, that victim speaks to. So it's just ensuring that you've got some awareness of where to signpost that person or direct them to, or where for you to get some more support and guidance as well.
Brilliant, thank you. And White Ribbon Day is coming up on November 25th.
Yes.
What exactly will this involve? How we're marking it?
So November 25th is White Ribbon Day, and that starts what we call the 16 days of activism as well. So we've been really, really busy behind the scenes, as part of the steering group. We've been doing some work before White Ribbon Day, so our really good patient experience team, they've been raising awareness at the Allied Health Care Professional Conference that's just happened internally, and also at Freshers Weeks across the North East, having a stall and talking to male and female colleagues and students at the Freshers Week and encouraging them to make the White Ribbon Pledge. On the November the 25th, and I think another day in the 16 days that follow, we're going to have a stall at both hospital sites. There's going to be resources with information, and I think at Sunderland we might be having a tree, a fake tree, not a real tree.
Yeah.
just in the main concourse, and where we'll be asking staff if they want to, they can write a message about anything related to violence against women and girls, so their own experiences, their thoughts, their feelings, or they can write a pledge if what they would like to pledge to for White Ribbon. We're going to be encouraging staff to have discussions in their departments with their colleagues at home. We're going to be releasing daily information on the intranet and social media, including the staff Facebook page. And we've got our ambassadors, so these are our male colleagues who have signed up to be ambassadors. We're going to be having photos with messages from them about why White Ribbon is important to them and why ending male violence against women and girls is important to them, and we're going to be distributing them. We've been working with the library as well. We're going to have a reading corner with reading materials, and they're going to have some recommendations on books about violence against women and girls. Also got our lead male ambassador, our chief executive Ken. He's going to be doing a video to promote the campaign and share his views on why it's important for the trust. As part of our team with the domestic abuse health advocates, we've kind of done some information about us that's going to be distributed so staff can try and get to know us a bit more. We've been looking at trying to get a donation or a collection for advent calendars. I know it's a bit early to be talking about Christmas, but some advent calendars to donate to local refuges across the area for children and mums that are in refuge. We've also been really fortunate to have resources to make up 20 bags for homeless, vulnerable patients who attend our emergency departments with domestic abuse or sexual violence. These are going to include things like pyjamas, underwear, soap, sanitary products, toothbrushes. And then we're also going to be sharing where people can just get more information. There's been loads of free training going on that staff can have access to. So we'll be publishing where staff can access them and how they can sign up to some training as well to learn more about violence against women and girls, it might be about domestic abuse, it might be sexual violence, it might be about misogyny, but yeah, there'll be loads of training going on, and we're trying to collate a big kind of plan that staff can access.
Busy few weeks then.
Yes, yeah, it's been a busy couple of months. There's been a lot of work happening behind the scenes, but the steering group's really, really good, and we all bring different things, so it's been quite easy in a sense that we've all shared the workload as well. So
amazing. So who's part of the steering group? Is it people from different?
Yeah, so we've got
department?
people from the safeguarding team. We have people from the patient experience team. We've got staff from our community mental health services. We've got someone from radiology. We've got people from maternity as well. So it's a wide mix. We've also got people from HR as well. So across all the divisions of the
Brilliant.
trust, across all the sites as much as we can. And if anybody wants to join at any point, they can as well.
Speaking of, how can people get involved in the campaign, whether they're staff, patients, general members of the public? So
staff, like I've touched on, can sign up to be ambassadors or champions, and they can access the White Ribbon website to do that. And if they go onto the intranet page and have a look at White Ribbon, they can get information on that as well. If you sign up to be an ambassador and a champion, you don't have to join the steering group, but you can. And obviously, if you do join the steering group, you'll be involved in not just what happens in the 16 days that follow White Ribbon Day, but we will be doing campaigns across the year as well as part of our action plan. Staff can also have discussions in the departments, talk about their experiences if they feel that they can, talk to the family and friends at home. Patients and public, the White Ribbon website's a free website. There's loads of resources on there. They can access the White Ribbon website. They can read news articles about what's happening about violence against women and girls. It's been talked about a lot. The government are really wanting to address violence against women and girls. There's a lot happening kind of in society. They can look at research. And they can also see what they can do in the local communities as well. So seeing if there's any volunteering opportunities with any domestic abuse services. Refuges often do ask for donations as well at certain points in the year, or for furniture, etc. So even that is helping to address violence against women and girls, making sure that the agencies that support these victims are supported as well.
It's opening up the conversation, isn't it, with absolutely everyone?
Yeah, just having discussions. But yeah, we're just asking people just to talk about it, just to raise awareness. That's what the whole campaign is about, just to raise awareness amongst everybody, not just within the trust, but at home as well and within the communities.
Brilliant, and thank you so much for your time today.
It's not a problem.
Really important topic. And obviously, where can people access support if they need it?
So we are here as domestic abuse health advocates, and staff can speak to us between 8:30 and 5, Monday to Friday, whether that's they've got a concern about a patient or they're concerned about themselves or a staff member. And you can, if you do want to contact us to get support for yourself, you can contact us confidentially. You don't need to give a reason why you're wanting to speak to the domestic abuse health advocate team. And also our intranet page as well. When we're not here, we've got information on how you can access domestic abuse support out of our hours as well. And there's the National Domestic Abuse Helpline as well. And even if you just type domestic abuse into the internet, there's loads of resources available, whether you're looking at support for yourself or someone else, or you're just interested. There's loads out there.
Brilliant. Thank you very much for joining me
No
today.
problem.
And thank you everyone for listening. We'll see you next time.
Thanks for joining us for this episode of our People podcast. We hope you enjoyed it, and check out our other stories. Hit subscribe to keep up to date with the latest, and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.